Hello, everyone. My name is Gabrielle Palmer, and this will be my community mental health intervention presentation in the HIV and AIDS population. First off, I'd like to talk a little bit about what HIV/AIDS is, get a good understanding of what we're talking about. So HIV stands for Human Immunodeficiency Virus. HIV attacks cells that help the body fight any type of infection. So you're essentially um, deficient in your immune system and ability to fight off anything, making you a little bit weaker. The body cannot fight HIV. There's currently no effective cure, though viral suppression is possible, as well as a more typical healthy lifespan. HIV can be contracted through contact with the bodily fluids of a person who is HIV positive. HIV is most commonly contracted through unprotected sex or sharing injection drug equipment. HIV progresses into AIDS. AIDS is acquired immunodeficiency syndrome. And it's untreated HIV escalates into AIDS when the body's immune system has sustained enough damage. HIV does not often progress to AIDS in the US anymore because many individuals do treat their HIV before it becomes AIDS. Without medication, people with AIDS can survive for around 3 years. Unfortunately, less if an opportunistic infection develops, which is just something that happens when your immune system is weakened and something is able to take the opportunity to infect it. So, contracting HIV and AIDS, there tends to be some misconceptions around these ideas. HIV can only be contracted by a non-infected person through contact with bodily fluids of an infected person with a detectable viral load. These bodily fluids include blood, semen, rectal fluid, vaginal fluid, or breast milk. The fluid of the infected person must come into contact with the non-infected person through a mucous membrane. A mucous membrane like the rectum, vagina, the mouth, or the tip of the penis. And open cuts or sores or a direct injection can also cause that infection to be exposed to the healthy bloodstream. The estimated HIV infections in the US by transmission by category in 2022, and this is from the HIV.gov website. 31,800 estimated new HIV infections in the US in 2022. 67% were among gay and bisexual and other men who reported male-to-male sexual contact. 22% were among heterosexual contact, and 7% were among those who injected drugs. I'll talk a little bit more about the ending the HIV epidemic toward the end. The overall goal of that is to decrease the estimated number of new HIV infections by 2025, which have not updated that yet according to their website. But we're getting close, and down to 3,000 by 2030. So hopefully we can reach those goals. Some demographic considerations I wanted to take into account that I've seen in the research. HIV can affect anyone of any gender, any age, sexual orientation, race, or ethnicity. However, in the US, gay, bisexual, and other men who report to have sex with men are most affected by HIV. Hispanics, Latinos, Black, African American populations are disproportionately affected by the chronic illness as compared to other racial and ethnic groups. It just so happens that there's more prevalence in um, these communities, and the more prevalent it is in the environment, the more likely you are to contract it, which just kind of continues to make that prevalence go up. This is also why it's so important to get tested, and why it's so important to be knowledgeable about how you can contract it and how to prevent it. Sexual behaviors among people diagnosed with HIV in the US by race and ethnicity in 2020. Percentage of people with HIV who had sex without using any HIV prevention strategy in the past 12 months. The highest on there is actually white people. Next is Hispanic and Latino, and then Black and African American. Getting and keeping an undetectable viral load is the best way for people with HIV to stay healthy and protect others. So even though the Black and African American community is affected more disproportionately by HIV, um, it appears as though it is white people who are engaging in sexual behaviors to contract it more often. I thought that was fascinating. So, some treatment options. I said earlier there's not technically a cure still for HIV. However, you can have what's called an undetectable viral load. And that means that with HIV treatment, you can bring the virus level down to an undetectable level. It means you can stay healthy and you will not pass HIV to others through bodily fluid. Many individuals can achieve this undetectable viral load within 6 months of beginning treatment, as long as it is started early. People on antiretroviral therapy is what it's typically called. It could take a combination of HIV medicines. They call it a treatment regimen. A person's initial HIV treatment regimen generally includes 3 HIV medicines from at least 2 different drug classes, and they have to be taken exactly as prescribed. So the goal is for viral suppression to happen, which is having less than 200 copies of HIV per milliliter of blood. And if you are experiencing or if you've been described as having viral suppression, then you are undetectable and you cannot transmit HIV. Some prevention strategies for HIV and AIDS include getting tested and being aware. Awareness is a pretty big help in preventing from getting HIV and helping those in the community from getting HIV. Getting tested is one of the only ways to know if you actually have HIV or AIDS. It often does not present any symptoms until it's progressed into later stages, and then your symptoms are probably fairly severe, and it would probably be other illnesses. Um, so you would really have to test for HIV and AIDS in order to determine if that's what the situation is. The best way to prevent the spread of HIV and AIDS is to treat those who have the illness so that they can achieve an undetectable viral load and no longer spread it to those around them within their circles. Some other prevention strategies include practicing safe sex using condoms. They call PrEP, pre-exposure prophylaxis. It helps prevent the spread as well as and it comes in the form of pills or shots, just like ART therapy or the antiretroviral therapy. Um, the pre-exposure prophylaxis is for people who know that they're probably going to come into contact or they have a partner who does have HIV or is getting treatment and may not have an undetectable viral load. You can still do PrEP if you have a partner who has an undetectable viral load, just as like a precaution. You can get PrEP pills delivered through the Damien Center in Indiana. You can do telehealth visits, a lot of good resources there for folks who have HIV or have questions about it. PEP post-exposure prophylaxis can also be administered within 72 hours of a possible exposure to prevent the virus from taking hold in the body of the person who believes they've been exposed. So, some of the main issues that people with HIV and AIDS face include discrimination and stigmatization. On top of already having a debilitating illness, they get discriminated against, and there's a lot of beliefs about people with HIV that I've heard and that they have personally experienced and have talked about in some of these cases and some of these studies. Some examples of microaggressions and discrimination would be assuming that an HIV positive person is dirty or takes illicit drugs or is sexually promiscuous. I'm assuming that their sexual orientation is gay or assuming that they're trans or believing that they deserve to get HIV because of their choices or because of their sexuality. Another example of discrimination would be refusing to provide care or service or help to a person who is HIV positive and that has disclosed that. Refusing to have casual contact with persons with HIV is also a form of discrimination. Overcoming stigma and discrimination, microaggressions, stigma, and prejudice make people feel ashamed and less likely to seek life-saving health care. That's something that they found that the CDC reports that Damien Center patients have reported that as well. It doesn't feel good. People know, is what they seem to feel, and it's not fun to um, it's not fun to have people assume that you're behaving a certain way if that's not the case. And even if it is, there's no reason for people to be assuming or making any type of comments. I'll take opportunities to learn about HIV and correct misconceptions when you hear them. Um, Mean comments are never necessary, and when you hear that someone is saying something about AIDS or joking about it or HIV, respectfully let them know that, hey, that's a misconception or that's kind of harmful to the community. Talk respectful about prevention and treatment and about ending HIV and AIDS in your circles and around the people that you spent time with. Be supportive of the goals and aspirations of people living with HIV and AIDS as well. They're just like us. There's nothing really different from someone who's living with HIV or AIDS from you and I, other than they have a disease that can't be cured. So remember to treat them with respect. So something that we can focus on as counselors that's really important for this community is palliative care. Palliative care is care that improves the quality of life of patients and their families through prevention and relief of suffering by means of early identification and impeccable assessment and treatment of pain and other problems, physical, psychosocial, and spiritual. That's just a definition that I found in one of the studies. They talked about palliative care, how it should be addressed early on in a diagnosis, preferably in stages 1 or 2, to help improve the quality of life and overall chance of survival for patients with HIV. Palliative care needs should be addressed on an individual basis and should be tailored to each individual's needs, just like any other type of care that we're planning on providing. Mental health counseling and palliative care. Counseling an individual with HIV infection is important because HIV infection is a lifelong illness, and to address the anxiety, denial, anger, and guilt experienced by patients. So that's something that we really want to focus on. Is that there's a lot that comes with getting a diagnosis that tells you that you'll have this forever. This is the situation. It's a lot to take in, and it's something that we need to be sensitive about when we come into contact with these clients. Participants in the study above stated that they would appreciate having someone to share their feelings and stress with due to loneliness. People get estranged from their families and friends when they find out that they have a diagnosis, either by choice or because their family members find them that, well, discrimination against them, honestly. They find that they're not comfortable around them anymore. Counselors should be prepared to address the next steps, treatment options, future goals, financial issues, relationship concerns, and any other variety of issues unique to people with HIV and AIDS, in addition to other everyday problems. Like I said earlier, they're not really that much different from us other than they have this illness. Um, so as counselors, we should be ready to be the first people to help someone who's newly diagnosed and to be prepared for that diagnosis and treatment to be also maybe like old news to some clients, depending on their situation and how long they've been in treatment and how long they've known they've had this diagnosis. But again, it needs to be addressed on an individual basis. Okay, so some mental health interventions that I found, some practical interventions start with recommended integrating nutritional counseling when administering palliative mental health care for several reasons. One being that food insecurity affects the HIV and AIDS population disproportionately compared to non-infected individuals. It's for several different reasons that they found it really just depended on the person and the situation. Accordingly, proper diet intake can boost immunity, slow the progression of AIDS and opportunistic infections, enhance body weight, and retard depression tendencies. As found by the same study. They did some really excellent work with diet. Another study Magnuson recommends a program called Act Healthy. It encourages individuals who are HIV positive to adhere to their treatment regimen. I mentioned earlier that treatment regimen is really, really important. They have to stick to it pretty much exactly in order for undetectable viral load to be achieved. So the AH is a combination of um, substance abuse counseling and supportive counseling and behavioral activation counseling. So it's a combination of I'm trying to get all these things together to help these people both stop using and continue consistently with their HIV treatments. The combination of behavioral activation techniques, which encourages clients to make tangible behavioral change, with supportive counseling, which creates a supportive healing environment, did prove helpful for several clients in keeping them up with their treatment regimen, however, not necessarily with the using side of that. The next study conducted research regarding the employment status of those with HIV/AIDS and how the ability to be employed can improve the quality and the length of a patient's life. I found this one really interesting because a lot of people with HIV and AIDS have a lot of problems with being exhausted. Their bodies are just tired. So they did um, have a combination of medication and therapy in that study, and 45 to 62% they found in the study 45 to 62% the HIV and AIDS population is unemployed. However, up to 74% of them would prefer to be engaged in the workforce. This probably does reflect and has something to do with the fact that being employed and being part of the workforce can enhance the length and the quality of a patient's life. So in the above study, participants were given a combination of medication which helped prevent drowsiness and counseling to help achieve their goal of beginning to search for a job after diagnosis, starting a new job, or getting into school. So they did have different goals, so the measurements were a little interesting for this one. Each participant who did make it to the end of the study reported an improved mood, and probably due to the medication, and depression status was improved as well. And most of the participants did achieve their goals of either getting into school, starting a new job, or starting the search for a new job. Special consideration should be taken when counseling a person with HIV/AIDS seeking employment and the unique challenges they may face in this realm. There's discrimination they may face there. People may not want to work with them because of their HIV status. In some places, they are required to disclose that status. So it just depends, and it will be unique in each situation. So, a few other studies in mental health interventions and counseling. Cognitive behavioral therapy as a means of promoting adherence to antiretroviral therapy and treating HIV/AIDS related depression. The treatment begins in this research section with a CBT-oriented intervention to address adherence called Life Steps, and I list the life steps down in a couple bullet points. It provides psychoeducation about ART adherence and identifies barriers to optimal adherence. Future sessions introduce orientation to CBT-AD, which is cognitive behavioral therapy for adherence and depression. Um, Activity scheduling, adaptive thinking, problem solving, relaxation, and relapse prevention. The therapist begins to draw connections between the patient's thoughts and the patterns of adherence with their antiretroviral therapy, which enhances the motivation and helps them kind of set goals for the later sessions and for life. The patients address adherence issues in this first session, set their personal goals, um, and those um, life steps that they address in later sessions include, let's see, psychoeducation is step one, to getting to appointments. These are practical things that your clients will probably be needing help with. Step three, communicating with treatment team, of coping with side effects, obtaining medications and other relevant health-related products, formulating a daily medication schedule, starting medications and medical supplies, or storing them, sorry. Cue controlling strategies for taking medications, handling slips and adherence, life steps review, and in the final sessions, life steps follow up. and that can take place in a phone call. They did find some pretty decent success with these methods in this study. I just thought it was a pretty good way to lay out practical things that you will probably need to address with a person with a newer diagnosis. Bordeaux, in their study, evaluated the implementation and beginning effectiveness of several different treatment methods for four main populations. Just another creative ways to treat this population. So the four focus areas of these strategies were transgender women, Black men who have sex with men, behavioral health integration strategies, and trauma-informed care. The groups for trans women address unique challenges faced by them, and resources for treatment and support for newly diagnosed individuals. So that was really what their focus area was. Strategies for Black men who have sex with men included a two-way text system, which I thought was really interesting. It encouraged the medication adherence. Interventions to encourage adherence to primary care and ART, like more traditional forms of therapy, and then promotion of PRP and substance use disorder therapies. I mentioned a couple earlier. Next, the behavioral health strategies included buprenorphine, opioid abuse treatment, collaborative care management and screening and referral, potentially for different facilities. If you need to potentially go to a substance abuse facility, they can screen you and have you potentially referred for that. Trauma-informed care was focusing on trauma-informed approach, cognitive processing therapy, and a program called Seeking Safety, which addresses PTSD and substance use, which is something that you may need to address with the client. So finally, I want to talk about ending AIDS in the US. Ending the HIV epidemic is a program that was started in 2016, and the strategy for ending the AIDS epidemic operates by focusing resources for treatments and prevention in the currently 57 jurisdictions where they're needed most. And you can look those up. It switches a little bit with the need. In our progress, we've done pretty decently. As of 2022, um, the number has been continuously reducing. They've not updated this yet, like I've said. However, in 2025, the goal is to have it reduced down to 9,300 new cases. Diagnosing all cases as early as possible is one of the treatment strategies for ending the epidemic. Another strategy is treating people rapidly to achieve an undetectable viral load so they can no longer spread it. Preventing new cases using proven strategies such as treatment for people who do have it, and safe sex practicing with condoms, and then finally responding quickly to outbreaks are the main tenets of this plan. So hopefully we are able to eradicate this in the United States by 2030. That would be excellent. And that is all that I have. Here is my reference page. I appreciate everyone being here and listening. I look forward to hearing everyone else's presentations.